Hey guys, I'm Joe Sebastian. I'm a registered nutritionist and dietitian, and today we're going to be talking about diabetes. We hear this a lot, diabetes, but we kind of want to find out, what is it? What does it mean? We're often scared by the thought of it, but we don't even know what disease this is. Diabetes is a condition where our body's blood sugar levels are much higher than normal. And this is because insulin, the hormone that controls our blood sugar, isn't working as best as it can. Let's break this down. See, when we eat food, our body breaks it down into smaller particles so that it's much easier to absorb and easier for the whole body to use. And when we're eating carbohydrates specifically, this is broken down into sugars. And then it's brought into our bloodstream so that insulin can take it to the cells and the body parts that need it to function. But when we have diabetes, insulin is not able to do this job properly. And there are two types of diabetes that we often look at. Type 1, which is called juvenile diabetes, or diabetes that is usually genetic to the body and to the family, where our body cannot produce enough insulin to be able to bring our blood sugar levels down. When we talk about type 2 diabetes, the most common type that we have right now, we're talking about having insulin in our body, but not having insulin work efficiently enough to bring our blood sugar levels down. And usually diabetes 2 is caused from lifestyle factors like poor diet, lack of exercise, and also other lifestyle-related behaviors. Did you know that 1 in 5 Filipinos have diabetes or pre-diabetes, or a high amount of sugar in their blood? Now, what to do if you actually do have diabetes? What is the way that you can beat this? Well, let's take a look at a few lifestyle modifications that you can do and incorporate into your life to make sure that you are beating diabetes. The main goal in managing diabetes is to achieve and maintain a normal blood sugar level. This can be done through diet, exercise, and regular taking of your medications. But today we're mostly going to focus on what we can do with our diet. Because it's oftentimes that we think we have diabetes, we have to cut off all sugar. But that's not necessary. We just have to look at the types of food that we're consuming and the timing of this food to control our blood sugar levels. My first tip for those who are trying to manage their diabetes is to eat or choose whole foods. And by whole foods, I don't mean whole cakes and whole pizzas. What I mean is more choosing foods that are minimally processed as much as possible. So if you're gonna go for your fruits, try to go for your fresh fruits rather than your dried fruits. Because that way there's more nutrients, and more important for diabetics, there's more fiber. Because number 2, increase your fiber intake. So what is fiber? Oftentimes we hear fiber and we think, it's mostly for the lolas and lolas out there, but fiber is actually very important for everyone. It's important for your gut health, it's important for managing your cholesterol levels, and it's also very important for managing your blood sugar levels. When you're able to increase the amount of fiber that you have in your diet, you're able to control the release of sugar into your bloodstream. More fiber makes it better for your blood sugar levels and make insulin have an easier time controlling it. One way that you can increase your fiber intake is by making sure you have more fruits and vegetables in your meals. Try to fill up maybe half of your plate with fruits and vegetables. Number 3, creating a meal pattern. This is very important for diabetics because oftentimes when you're consuming food in spontaneous and erratic times of the day, your blood sugar levels could shoot up and go down. But if you're having a more consistent meal pattern throughout the day, for example, eating every 3 hours or every 2 hours, it's easier for your body to be able to bring down your blood sugar levels when it spikes up. Small, frequent meals is ideal for those with diabetics, so it can help maintain their blood sugar levels throughout the day. Let's imagine this. You're having a big meal, all of a sudden your blood sugar levels spike up. And of course, since your body has to react to this, it tries to bring out all the insulin it can to bring it back down. But if you're having smaller, frequent meals throughout the day, your blood sugar levels can be more controlled and maintained throughout the day without having big major spikes and dips in your blood sugar. Number 4 is carbohydrate choices. It's very important that we make sure we're choosing high fiber carbohydrates, or what most like to call low glycemic index carbohydrates. So your glycemic index is basically what tells you how fast a food item is going to shoot up your blood sugar and how fast it's going to bring it down. The higher the number on the index, the faster it increases your blood sugar. The lower the number on the index, the slower it increases your blood sugar. So when we're talking about those who have diabetes or even those who have PCOS, it's very important to choose food items that are lower in the glycemic index. You have to choose your high fiber carbohydrates that is better for your blood sugar. So let's give an example. When we're choosing our white rice, this usually has a higher glycemic index than your brown rice. The reason why is brown rice has more of the nutrients in it as well as more fiber. So with more fiber in your brown rice, it's much better on your blood sugar levels. So these simple swaps that we can add to our diet by changing up your more simple processed carbohydrates into more complex high fiber ones can be a great solution to helping you manage your diabetes. Final tip for managing diabetes is increasing your unsaturated fat intake. What is unsaturated fat? When we're talking about the fats that we consume, these are like your oils, your fats, your avocados, your coconut creams, your chia seeds and flax seeds, and most of these are from your unsaturated fat sources or your plant sources. Because when we're talking about saturated or trans fat sources, these are usually from your animal products as well as your packaged food. The difference between the two is that saturated and trans fat tend to increase our bad cholesterol, while your unsaturated fats decrease your bad cholesterol and increase your good cholesterol, which is something that is very beneficial for those with diabetes. Because when you have diabetes, your blood vessels are kind of in an intense motion when blood sugar is high. So it's more susceptible for you to have cardiovascular diseases. That's why it's very important that if you have diabetes, you're also managing possibilities of getting these other diseases like cardiovascular diseases and hypertension. So when we're talking about diabetes, it doesn't have to be a scary thing. I know it sounds like it, but it doesn't have to be difficult. All you have to do is make a few dietary modifications, start exercising, and of course, be consistent with your medication. With a few changes in your life and your diet, you can easily beat diabetes. My name is Jo Sebastian, and I'm a registered nutritionist and dietitian, and I'll see you in the next episode.